Nearly 23,000 new cases of coronavirus have been reported in India in the last 24 hours. And as a matter of concern, new cases detected are 27.5% higher than cases reported yesterday. According to Ministry of Health, over 18,000 recoveries and 126 deaths due to COVID-19 have been reported in the last 24 hours. 77% of the fatalities due to COVID have been reported in 5 states, including Maharashtra, Punjab, Kerala, Karnataka and Chhattisgarh. For more on this, we have Dr. Rajeev Jayadevan, scientific advisor to the IMA with us. Dr. Jayadevan, thank you so much for joining us. Dr. Jayadevan, now Maharashtra is really seeing a big spike in cases. I believe 13,000 new cases in the last 24 hours. What is the way to control it right now? Is a lockdown, or at least a mini lockdown of sorts in Mumbai and parts of Maharashtra, the only option at the moment?
At this point, we are seeing a surge in many parts of the country. And this is because the virus is spreading from people to people. So unless we physically separate the infected people from healthy people, the virus will continue to spread. And unfortunately, the caseload in many of these places is so much that it is difficult to control this virus without stringent measures. But what we need to be looking at is how overwhelmed are the health services. Are the health services able to cope with the present load, keeping in mind what happens today in the community will only be seen in the hospital in 4 weeks. There's a 4-week lag between the present situation in the community and what's happening in the hospitals. So authorities look at these projections over a period of time and then decide whether a lockdown will be necessary or not. That depends strictly on the local data and the prevailing conditions. But you asked about what can be done in the long term. The first is to realize that a pandemic is not over. Unfortunately, on the ground, many people, including healthcare professionals, are behaving as though the pandemic is a thing of last year. It is not true. We are somewhere in the middle of a very long process and we don't have an end in sight. There is no shortcut to the standard precautions. It's not like a movie that gets over and everybody gets out and gets on with their lives. It is not. The pandemic is a long-term process. We need to put in the processes.
Right. Sir, the problem is in crowded metros, in the crowded big cities, social distancing is really very difficult. Now, if we were to think about Mumbai, the locals, for instance, in Mumbai, the Mumbai locals, which are the lifeline of the city, are so crowded and packed, it's almost impossible to ensure any sort of social distancing. Even wearing masks may not be possible in locals. Do you think we need some restrictions on public transport systems in the bigger cities like Mumbai, for instance?
I do not know. I'm not an expert on economics, so I can't comment on that. But what I can say as a medical doctor is the virus jumps from people to people when people sit together or stand together in closed spaces and talk. Masks are effective. Maybe we can ask people to wear better quality masks, keep distance to the extent possible, spread out the transport mechanisms. But these are logistical decisions that need to come from people who are familiar with the local conditions.
Right.
But
Sir, I have actually traveled in Mumbai locals for almost 3 to 4 years, and I can tell you it's almost impossible to talk about social distancing. They are packed with people.
It truly is, which is why we must be extremely careful in crowded countries like ours. We should have been a little bit more careful before many parts of our country declaring that we have conquered the pandemic. It is not. This virus is spreading all around the world, and many parts of the world are in severe distress. Look at Brazil now. They are in deep trouble. And you can't blame a country for it. It is the same virus. We need to learn from the experiences of other people. Wherever there are crowds, wherever people meet, especially in closed spaces, the virus will spread. It does not matter what country it is. We need to be aware of that first. That is the most important step forward.
All right, sir. And will speeding up the vaccination drive help? Maybe involve more hospitals if possible, put more hands into the entire process, speed it up? Would it help in keeping a lid on the pandemic?
It will. it will keep a lid on the deaths and severe disease and the burden in the hospitals. Remember, COVID-19 is a disease that causes a large range or a wide range of problems, ranging from no symptoms all the way to death. Vaccines prevent the severe part of the range, which means that you could still get the infection, but you may get away with a common cold or a little bit of a cough. That is a hope with vaccines. They may not stop your spread, and that's very important we realize that. Vaccines do not provide sterilizing immunity, which means it does not stop the virus from infecting you. So it's very important we let the public know that the vulnerable will need to be vaccinated to reduce their death risk, but it's a continued use of the traditional trace, track, test, isolate strategy and social distancing that will keep a lid on it. It is not vaccination alone.
Right, sir. And the cases that are coming in are from states, industrialized states like Maharashtra and Karnataka. Now, there are a lot of international and domestic passengers in these states. I mean, cities like Mumbai and Bengaluru see a lot of international passengers, a lot of domestic passengers. What can be done really to control the spread, to stop these states from becoming the epicenters of the pandemic in the country?
You're right. Wherever there is increased travel, it doesn't matter what part of the world you are in, the places that are most connected with travel out of region for whatever reason are severely affected by the pandemic. And if you look in any part of the world that's severely affected, you will see the same pattern. So some regulations have to come in, and that has to be taken by the local authorities on that.
Should we scale up testing, COVID testing at international airports and domestic airports? I'm sure it's being done. Do you think more needs to be done?
Well, international airport, as far as I know, they are very, very good in terms of screening people, and the airlines are good at screening passengers. So that part, I believe, is well covered. But what we do not have a handle on is India is a very large geographic region, and what can we do as a nation to regulate traffic between regions? You know, we have to let people live their life. At the same time, we have to stop the virus, and the two may not always go hand in hand.
All right. And sir, before we let you leave, there is a case of the South African variant in India now. Do the vaccines prevent the new African variant from spreading, or at least making the infection less severe? And is it any cause for worry that we have seen the South African variant in the country? What can be done to prevent more such cases from cropping up in India?
It takes only 12 hours for the virus to travel halfway around the world. So it comes as no surprise that this variant has reached India. We know it only because we tested it. Now, whether this variant can be controlled by vaccines, there is evidence now that vaccines can control it. But unfortunately, evidence is slow, because which means that you need to study extraordinarily large numbers of people over a long period of time to see the exact efficacy of the vaccine against this particular variant. So the preliminary information is that vaccines do work. There is no need to be worried, because vaccines work on many fronts. Remember, we test only antibodies, right? We hear about antibodies, we talk about antibodies, we breathe antibodies. But in reality, the protection that we get come from many parts of our immune system, which we don't describe and are not able to measure. For example, the T cells, the innate immunity. So there is no way you can measure those. So in reality, in field conditions, how the virus behaves will only be known with time. But the preliminary indications across the scientific community is that vaccines do work to a large extent, even against the new variant. But among the three big variants, South African is the variant. You can't call it South African. You have to call it 501Y.V2. You can't put a name of the country to it. This particular variant is the one that's most concerning, but that doesn't mean vaccines don't work.
All right, sir. So that's good to know. Thank you, Dr. Jayadevan, for joining us with all those insights. Right. So what's a bit worrying is that industrialized states like Maharashtra and Karnataka are seeing a spike in COVID cases. Maharashtra particularly a bit of a concern at this moment. Public transport systems can spread the virus, as Dr. Jayadevan was also pointing out. Bombay has packed locals, they can be super spreaders of the virus. So what can the government do to possibly contain it? Lockdown would obviously be the last option because it really hits the poor very hard. It will have to be the last option, but we'll have to wait and see how the virus plays out. One of the ways, obviously, to limit the spread of the virus and make it less dangerous is vaccination, as Dr. Jayadevan was pointing out. So we need to speed up vaccination. If the industrialized states, we see a lot of international and domestic passengers see a spike in COVID, clearly it'll hurt our economic recovery, our nascent economic recovery. OECD recently said that we'll grow in double digits. India will be one of the fastest growing economies in the world. But that is obviously predicated on the assumption that we'll manage to keep a lid on the pandemic. This appears to be a second wave in India. India Ahead was the first to talk about it a couple of weeks ago, or probably even before that. Let's hope we can speed up vaccination, ensure social distancing, and keep a lid on the pandemic. Otherwise, it may just mean our economic recovery is hurt. Slipping into a short break.
You're watching India Ahead.
Did you ever imagine that the government would come to your home to help you get a driving license, or a marriage certificate, or a water connection? That you won't need to make multiple trips to government offices?